everyone, hi. In today's interview we have Dr. Tapaswi Krishna, MBBS, MD, FICCM, Senior Consultant Pulmonologist, Shenoy Hospitals, East Marredpally, Secunderabad. Yes, now let's talk to the doctor and gain some knowledge about the lungs. Hello Dr. Tapaswi Krishna.
Hello Anusha, how are you?
I'm great, ma'am. How are you doing?
I'm fine.
Sure. Okay, so Dr. Tapaswi Krishna, to start with, can you explain us what is the best way to avoid lung infection?
Yeah, absolutely Anusha. So lung infections, we need to understand what kind we have these days. So like the general public already knows, you have an upper respiratory tract infection or a lower respiratory tract infection. So coming to the upper respiratory, you'll be having cold, cough or sneezing, and lower respiratory tract infections, people have acute exacerbations of COPDs or pneumonias. So how do you avoid all these upper respiratory and lower respiratory infections? It all boils down to increasing your immunity and protecting yourself from people who are carrying infections. So increasing lung immunity, it just works out with very good exercise, and especially the breathing ones like yoga and pranayama. Apart from that, there is a high protein diet which we definitely need to follow if we have to maintain our immunity. Coming to the next thing, that is vaccinations. If a patient needs better immunity for lung infections, they need to take certain vaccinations, which we will discuss further down as we go down in the interview.
And everyone has a wish to know how can we make our lungs immune.
Yes.
Yeah. So can you please say it on that?
So if we have to make our lungs immune, the first thing we have to concentrate on is completing our vaccination schedule. So nowadays the most common infections after COVID have been influenza. Especially we have 4 influenza strains which we give patients vaccinations against, especially people who are older than 60 years or patients who are less than 60, over 45, and who have other disorders like diabetes and hypertension. So your annual flu vaccines are of utmost importance so that you don't keep catching the repeated pneumonias or URTIs. And apart from that, please update your COVID vaccinations, which will help you not catch the infection. Even if you catch it, you wouldn't be getting a severe form in case you are vaccinated against COVID. Apart from this, the third vaccine which you are supposed to keep in mind is your pneumococcal vaccination, which comes as once in a lifetime vaccine, or there is a different kind which can be taken once in 5 years. So your pneumococcal vaccine, your influenza vaccine and a COVID vaccine have to be updated for your lungs to fight the disease. Apart from that, you have food which helps you in fighting immunity. So you have to be up to date with your high protein diet and your micronutrients. So there are some micronutrients like silymarin which help in lung to be more immune. Especially your food should contain high zinc content so that immunity is taken care of.
So Dr. Tapaswi Krishna, can weak lungs get stronger? If yes, what should be done for that?
So weak lungs, how do we define weak lungs? So if you want to know if your lungs are weak or strong, you can make different categorizations. Like you have to check your lung function test, which will tell you if your breathing capacity is adequate or not. And sometimes it's not the lungs alone, but your weak muscles, low muscular power, which can be because of various diseases. In fact, smoking also will cause a loss of muscle mass because of chronic bronchitis. So you decide if it is because of your lungs or because of your low muscle mass. If your lungs have been infected with TB or bronchiectasis in the past, you can improve your lung immunity and make your lungs stronger by following certain breathing exercises, especially doing an incentive spirometry, which will be suggested to you by your pulmonologist. So if you can meet your pulmonologist, they'll tell you how you do your incentive spirometry and certain positive expiratory exercises, especially in patients with bronchiectasis. If you are a patient of chronic bronchitis and your muscles are weak, it's worthwhile to increase your muscle strength by supplementing proteins in your diet so that you build more muscle mass and you are stronger to breathe better. So your breathing exercises, high protein diet, increase in your micronutrient will definitely make your lungs, which have been weak, stronger. You visit your pulmonologist routinely and try to do your pulmonary function test, which will tell you at what capacity your lungs are so that you can improve upon it.
So, doctor, as we are talking about breathing exercises, so can you tell us some breathing exercises for strengthening of lungs?
Absolutely. So, if you need breathing exercises to strengthen your lungs, in yoga we have what we call as pranayamam. So, one nostril is closed and you take a deep breath and relieve yourself from the other nostril. So, you do this 12 times, 3 times a day. It's a worthwhile breathing exercise. The second one being you get something called an incentive spirometry. The kind which you should need will definitely be advised to you only by your pulmonologist once he or she sees you. So, doing incentive spirometry prescribed according to your lung condition by your pulmonologist would definitely help you in increasing your lung capacity.
And doctor, can we know what are the best foods for strengthening of lungs, and also what are the worst foods for lungs so that one can avoid it?
So the best foods, let us say for strengthening lungs, like I have already been saying so, a high protein diet, especially containing egg whites, chicken, fish. These are the ones which give you a high protein diet. And if you are a vegetarian and can't take all the above mentioned foods, you can go ahead with tofu, soya, which is of course poor man's meat, and your diet should contain a lot of paneer or pulses such as chana dal or urad dal. These are the things which will have a high protein. So once you have high protein diet, your muscular strength goes up, as well as your lung immunity is way better than when you're not having a high protein diet. So make sure your diet contains almonds and dry fruits, which will definitely give a boost to your immunity. Apart from that, your micronutrients which gives better immunity are silymarin and zinc. So these are the ones which will help your lung cells fight bacteria and virus when they tend to attack the lung epithelium. So unlike other organs in the body, one thing all of us should understand about lungs is they're out in the open. Like you breathe in air which has millions of bacteria and virus. So it's very important your lung is immune to all these bacteria and virus which are having a through air, just entering your lungs from anywhere in the air. So that is the reason we are supposed to maintain immunity. Make sure when you're going into crowded or polluted environment, make sure that you have a mask on, so that when there are too many people, the air that they are expiring or the bacteria that they are expelling can be stopped by your mask. You wear a mask, you are actually protecting two of you, not one of you. So the person in front of you and yourself, both of you all are protected.
Dr. Tapaswi Krishna, what are the most common infections of lungs due to low immunity?
So because of low immunity, we tend to have a lot of problems with the lungs. The first thing being tuberculosis, which is so common in India. Apart from being a lung disease, tuberculosis can affect all the other organs, that is extrapulmonary organs. Most commonly we'll be seeing abdominal tuberculosis and genitourinary tuberculosis also, which could be a leading cause of infertility. So tuberculosis, which affects almost 66% of Indian population, causes infection in almost 66%, but the disease is way lower. So it doesn't manifest but could be lying down as latent tuberculosis. So why are we so concerned about immunity when it comes to TB? So though that bacteria affects the body, it doesn't tend to invade or cause a massive infection, because immunity tends to take care. If you are immune, the cells in the body will contain the tuberculous bacteria and you won't be giving out symptoms. Whereas the minute your immunity goes down, either you catch diabetes or your nutritional status has gone bad, tuberculosis tends to raise its ugly head and you'll be seeing the symptoms of TB. Apart from that, pneumonias are very common when you have a low immunity. So pneumonia could be bacterial, viral. Like we have seen in the recent past, even COVID can cause a very bad pneumonia. And of late, we see influenza pneumonias very commonly. So low lung immunity will make you very susceptible to infections, especially tuberculosis.
And doctor, can you please explain us what is the effect of vitamin D on lung immunity?
Vitamin D, like you know, is supposed to be very common just because we have the sun sitting out there in India especially, but the mirth is that we all have excess of vitamin D, but that's not the right thing. Most of Indians are deficient in vitamin D if we look at statistics, because there are hardly people working out on the roads or getting exposed to the sun. So we have to keep in mind that vitamin D deficiency can cause infections in our population, and there have been studies, especially in the UK and in India, showing that deficiency of vitamin D can cause tuberculosis of the severe variant. So it's worthwhile to check your vitamin D levels and take a supplementation so that your lung immunity is better. And like all of us know, vitamin D definitely will affect the bones, and we've been seeing a correlation of bone TB if there is a vitamin D deficiency. Worthwhile to go and check your vitamin D levels and supplementing as and when possible, especially our female counterparts in our country, because they definitely need stronger bones because they are drained more.
Very well said, doctor. And also, can you please explain us how does one improve lung health after COVID-19?
So COVID-19, the pandemic which we have all dealt with and fought with at every level, honestly, the general public as well as doctors, nurses and administrative people all over. It's been a big deal. So it's not only about lung health but also about our mental health after we have gone through COVID-19. So COVID has had the effect of decreasing immunity in a person, as well as we have been seeing a lot of post-COVID phenomena, especially in our Indian population. So coming to the lung health, COVID has left what we call as scarring on the lung tissue, which makes the lung more susceptible to other infections in the coming days. So once we have seen COVID and been vaccinated with COVID, the kind of infection you will get again with coronavirus is not so severe, but because of the effect on the lung tissue, we are seeing bacterial and viral infections more common, more fatigue for a patient, or they're not able to recover so well after a COVID infection from other infections. So how do we increase the immunity? Make sure even though you have had COVID, your COVID vaccination is up to date. Please be vaccinated for other infections like influenza and pneumococcus in case you are over 60 or in case you are less than 60, more than 45 and you have diabetes, hypertension or any other organ transplantation. So up to date with your vaccinations, periodic checkup with your pulmonologist, routine chest x-rays if required, and never ignore a cough by taking Vicks or Strepsils. So you have a cough for more than 3 days, please see your pulmonologist and don't ignore any symptom, because that's your body telling you see your doctor or address this problem. This is what I have.
And doctor, most of them have this doubt of the question which I'm going to ask now. Can damaged lungs regenerate?
So that's a beautiful question, Anusha. So damaged lungs regenerating, it's more of theoretical, and we've been giving what we call as stem cell therapy to regenerate damaged lungs. There are various studies and the results being midway. So if we are giving for 10 patients, we are seeing almost 5 to 6 people having regeneration of the lung parenchyma. But if the lung is totally damaged, it's worthwhile taking a consultation with a transplant pulmonologist to understand if a lung transplant would help, rather than wait with stem cell therapy to see if it's going to regenerate. There's nothing like regeneration of the lung parenchyma, but whatever lungs, you have 2 lungs, so whatever damaged part of the lung is, you should protect it from getting newer infections and protect the undamaged lung from worsening. So all we can do when we have part of the lung damaged is you can protect the undamaged lung from worsening.
Thank you so much, doctor, for your valuable time and sharing us many details about the lung diseases, infections, and what are the breathing exercises one should follow, and also about the foods we have discussed. Thank you so much for everything.
Thank you, Anusha. Thank you for patient here.